Take a deep breath in. Is this too much? Okay. If it goes a little bit, I'll take it. Go ahead and explain to me then what brings you in and what you're feeling.
Okay. So I have a lot of like tension, mostly neck, kind of like goes out to my shoulders, mostly from working in dentistry, kind of hunching over a lot, twisting.
Can you switch sides in dentistry?
Only if you're left-handed. So since I'm right-handed, I'm always on the right side of the patient, usually working on their right side or like directly behind them.
If you are on the right-hand side of the patient, are you twisting then to the left?
Twisting to the left, sometimes scooting in, but again, so if it's kind of like a quick kind of going over something or a quick procedure, I'll just forget about the posture and go into it.
Right. I wish it was almost like you could do it like robotically, like looking this way and be here, you know.
That would be nice.
But because you're here, it's just going to really put strain on your neck. Anytime you look down, right? You know, there's just more torque on the system. And then if you're hunched this way, because if you do this, now you've got to lean on something. Like you see me, I'm in here, but I'm always leaning on the table.
Right.
And I'm keeping my back straight. I get made fun of all the time. But it's okay. You know, I'm trying to keep my back straight at all times.
Right, you have to save your back too.
To save my back, working on somebody else. Yeah, I just feel that knot there. So that's the looking down. I'm surprised that there's not more over here.
My left side is definitely worse than my right when it comes to my neck.
Interesting. Most people have this shoulder higher and this shoulder. That's why I was like, hold on, stand up and let me check, because you have a huge knot over here. Most people have it over here. I'm wondering why this is here. You know, did you have any injuries when you were little? Did you?
No, no car
Never
accidents,
fell,
never fell. Wasn't really that into sports, so no sports
Okay,
injuries.
then it just might just be the way. I have to acknowledge this because when I adjust you, I don't want to push the wrong way.
Okay.
That's all this means. And when I'm feeling your knot, so I was like, I better check her postures. This is right. Nope, this is matching the other way, which I just don't see as much. So like, I don't know. Do you have things in dentistry where it's like everybody has something, and then once in a while it's on the other side, or you know what I mean? Like
it does happen.
That's what this is. I'm like,
you have to like double check yourself.
Yes,
Like, am I looking at this right?
Yeah, that's what I'm doing right now. All right, go ahead and on your back, face up. I'm feeling. We're gonna start out with the massage, okay?
Okay.
This to me, the neck is the most intense one.
Okay.
And we get that one over with off the bat. It's the
Okay.
first one. And once that's done, it's done. Just breathe, because here we go. You tell me, is that okay? Okay, is that real bad here?
It's tender, but not
Terrible?
Yeah.
And the back is more kind of, it's usually something you're more familiar with.
Okay.
Whereas the neck is kind of like, whoa, I've never had anybody do that to me. But I believe this is your good side here, yeah.
Ooh.
Very good. That was like a little baby one too, but I had to go for it. Are you okay?
Yeah.
Okay, other side. It's always kind of one of those weird things, like, I'm gonna really let her do this. Okay, and then same thing here. This side is a little stuck, okay?
Okay.
There it goes. Not anymore. But that was a little rough there. Excellent. Now this should feel really flexible right here now. See that? That'll drain.
That's nice.
Gomphosis, that's the type of joint a tooth is. Here I am taking it all of my dentistry stuff. So the tooth is kind of like a joint. At least that's how we learned it. But it's a movable joint, so they call it a gomphosis. For different types of joints, synovial joints, right? Or Gonna pop where the tooth doesn't really pop.
Hopefully it doesn't pop.
No. But I'm just thinking, it's not the same at all. But these joints you can move and they go right back.
Mm-hmm.
You know what I mean? You're just taking it through its range of motion very quickly and letting it kind of settle.
Mm-hmm.
So that was a move. You don't want to go, let's say you're kind of curved like this, right? I don't want to push you too far into that curve that way. I want to try to push you and encourage you to go back the other way.
Mm-hmm.
And that's more, you're going to feel that more on the back.
Okay.
Okay. Now the toes, it's more like proprioception. I'm not sure if you know what that is. It's how you tell your brain where you are in space.
Okay.
Like, oh, I have a foot. Oh, I have a toe. Try to turn the wires back on. Get blood flow, circulation. If you're saying your legs and your feet are, things are humming at the end of the day. Let's see what's going on. No, nothing wrong with the toes or the nails at all? Or?
I run a lot, so there might be some missing nails.
Oh, I just was thinking you should see who comes in here. Sometimes people's nails, they have an artificial nail or they have a.
Oh.
So I'm pulling on the nail a little bit.
No.
So I'm asking.
Nothing like that.
No, I'm not.
I run a lot and they fall off.
Oh,
and they look gross.
I know. I ran the other day. You should see the tops of my feet because I kick.
Ooh, they're bruised.
Yeah, that's from kicking the bag. I do taekwondo and so they're.
Okay.
They got
So
calories.
you understand.
Don't worry.
I'm no foot model.
No, neither am I. Whew. All right, ankles. Relax your foot towards your face. Good. I'll be careful. Here we go. Got you. Good. Knee. Gotta take your knee. Good. You're gonna slide down the table a bit. I'm gonna slide you. Good. Excellent. Good. All right, so that was the neck and the legs, okay? Now, if you want to go ahead and take the top shirt off.
Sure.
There you go. Just make sure nothing your face isn't hitting this piece or this piece.
Okay.
Yep, right down in there. And then your hands go right here. Yep, right there. Now I won't step on them, okay? And I do see this kind of curve here.
Mm-hmm.
So, yeah, there's an increase in the kyphosis of the thoracic spine, okay? That's from your work and studying and all of that. Okay, you all right with this kind of pressure? This is about where I would take you.
Yeah, that's fine.
Okay. Do they do quarters or semesters in dental school?
We do semesters, and then it's 3 semesters, I guess, a year, just because we go through the summer.
Some chiropractic schools do that. We call it a quarter because they change it every 3 months.
Tap it again?
Tap it? Sure.
Yeah, it's fine.
Okay. Good. I know. Man, that's just really stuck there. Take a deep breath in. And out. Wow. You're so tight. Okay. It eases up towards the lower part.
Mm-hmm.
It's just really in here. I'm going to pull the tissue right here, okay? Just like that. No, not too bad adhesions there, okay? It really isn't bad. All right, so I'm going to do one more. I am going to push a little harder, but not any more than what you've already felt, kind of like what we were doing up here.
Okay.
That is all it goes. Without injuring you. Without really letting you have it, that's all it goes. All right. Here's the soft tissue work, okay? This should feel more like a massage, kind of a really intense massage. Stop me if you need to, okay?
Okay.
Yeah, it's this curve right here.
Yeah, it feels
Feel
like tender.
that versus that. Feel that?
Mhm.
That's that. There's a slight little lateral curvature. Not enough to call it a scoliosis. But wherever that curve is, that lateral curve, you will have a buildup of inflammation. Because as the one side gets compressed, you see, and then this side. Yeah, yeah. Just get underneath here real quickly. Excellent. I'm gonna lower this down. Yeah, I got you. It's gonna feel a little nervy, okay, as I go through here. The brachial plexus is right there. There she goes, okay. How can I access these nerves? Oof, and there she goes. Good, 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 good. Woo! Tighter on this side.
Mhm.
Well, it's that curve. That's why I was like, are you left-handed? No.
I promise not.
Just kidding. I mean, it's like it never follows what you think.
Right.
You're like, oh, the obvious answer is it handedness. No, it's not. But see how you're not probably as sore over here?
Mhm.
So this arm is your worker, and that's why it's more built up.
Mhm.
So that's your muscle right
Oh
there.
yeah, I can like feel like a little
Right,
limp
where
there.
it's like more, it's less developed over
Mhm.
here. So you are using these inferior spinatus, the lats, way more on the right, which is, you know, for your work or whatever, you gotta do what you gotta do.
Mhm.
That side versus this side.
The left side feels a little bit more.
It's a lot more. It's like twice the size of the right.
Yeah, that feels fine.
Okay, I'm just trying to compress this swollen side here. It looked like it was gonna thunder, and then it just kind of stopped. That's Florida for you. Is it 3 o'clock yet? I bet I'll look it up and find it. Do you have any opinions on TMJ? Like why so many people are
You know,
with their jaws like that?
I see maybe once, like every couple of weeks, a patient with it, just because I feel like younger kids don't have it as much.
right?
I'll see it more like in my teens, and I always feel bad because my answers for them are minimal. You know, I tell them I wish as a whole field we understood more about it, because we do, and there's specialists that do just TMJ, but a lot of the work is like, I guess, just palliative.
Yeah,
There's not
it's
really
not
a
really
fix on it.
Like a bite guard is not going to protect. It's going to protect you from ruining your teeth, but your
Right.
jaw is just going to still have that pressure.
Right, and with like my specialty, a mouth guard's really the most I can provide.
Right.
And I like, you know, help them with like massages, maybe like putting pressure on the joint and then letting go and
Right.
kind of opening and closing. But then I kind of refer them to a specialist if they hurt too much, and from there they.
If anything, if they're really bad, they need to have it like restructured, like their whole jaw is replaced.
Yeah, and I've seen them do the, like, where they kind of wash it out, really. Like, they stick, like, a thick needle in there and kind of run this fluid. But, again, it's something that they have to... mostly it's older patients, but they'll do it, like, once every
a
6
little
months or
patient.
something.
Yeah, we kind of pop it open a little bit, like click it,
Mm-hmm.
and that allows some pressure. But if they keep clenching, it's just going to keep deteriorating. For me, it's always the clenching.
Mm-hmm.
That 70 pounds of force when they bite down. And they're just, and they're just destroying their joint. Or is when they had their mouth hung open when they get the wisdom teeth taken out.
Mm-hmm.
I keep seeing that. But I can't say one is related to the other. Or one is it's like, well,
Right.
it's not really my thing. But I have so many people coming in here with TMJ. I mean, with problems with their TMJ, and I'm like, geez, guys.
The scary ones are when like some people get like locked open or locked.
Oh, those are the fun
too.
ones for me. Yeah, they get locked closed or locked open. Oh, those are the fun ones. I wish I could have one like to film. I've had it happen, but like everybody's like, get that camera out of my face. Don't film this. But it's so fun to pop those open. You could do it all through the muscle. You don't have to do it through the manipulation.
Mm-hmm.
I'm pushing your muscle in so that you contract and then it pulls itself back over. But the spine is hooked up to so many structures. So it's
Stubborn.
It's stubborn. It's hard. That's why you have to lay yourself over a foam roller of some sort, or fulcrum, to have any kind of permanent change. Think about how much you have to do with braces.
Oh yeah.
And that's an easier joint almost to move or to manipulate. Well, I guess depending on the age. I guess a kid it would be easier, maybe not an adult. But, it's kind of that idea. You have to reshape.
Mm-hmm.
And to carve out a new spine is, that's going to take some time.
Do you recommend like every day for like a couple minutes or?
So there's a debate. The physical therapists say 5, chiropractors say 20. So you pick. Somewhere in between, okay? But if you're feeling that pain in your low back, here we go. Stick the fulcrum up here, not down here. Just trust me on that one.
It's ingrained in my mind.
When you think of it this way, do you know about the curves of the spine? Like that you're supposed to have a lordosis in the lumbar spine, a slight kyphosis in the thoracic, and then it goes back to a lordosis right again in the cervical spine.
Right.
Okay, so people try to force a lordosis in here. But what happens is they jam the facets. They bust them. So what we do, then they just create more pain. So you have this with the fulcrum, and this is pulling it down with the weight of the pelvis. And it arches the lower back all on its own.
So it's kind of like the path of least resistance.
Yeah, you're by reducing this actually increases.
That is very tender there.
Sorry,
No,
that's a
you're
rip.
okay.
That's a rip. I was trying to like.
I'm just always surprised by like the very specific spots that.
It is what it is. Fixing the camera girl's hand in between the patient.
It happened.
There we go. Okay.
It's an important job.
But you're not bruising too badly. So what I'm going to have you do is don't worry about the face paper at this point. Just come on up and you're going to raise your right arm above your head and you kind of go off the table somewhat. Sure, I'm going to open this side up, so we're going to push you that way. Yep. We got to compress this side. Okay. And like really open that up. There we go. Now I can get in there. Relax that down. You can go back down again. This is like a deep yoga session or something. Okay, I'm gonna go up into the scalp where you said you were tender.
Mm-hmm.
Tuck your chin for me a little bit. I'm gonna do the neck. Left side of your neck is bruising. Sometimes it's behind the ear.
Yeah, that's tender too.
Mm-hmm. Yeah, it's you got congestion in there. It doesn't just end here.
Right.
It goes all the way up. So like C2, C3, right? They go up in here. Just work on it. Get some blood flow in there. You know, I don't think it's over here though at all. Nah.
No, that's not even
No. There's nothing. Mm-mm. Mm-mm.
I realize how lumpy my head feels.
Your head is just fine. Okay, so just be aware of that, that you have that there. Okay. I got rid of some of it, like half. But to get rid of all of it is like really intense. And a lot of it just goes away on its own if you let it drain. Like with just the adjustment. Sometimes you'll see me come in here and like pull. Trying to get rid of some of that tension there in that fascia. I don't pull it off. I don't separate it. You don't want to separate it because then blood gets under there. You just want to mobilize the tissue. It is, you know, it's just there. That's going to have to drain. Okay. So come on up. I know I've got your hair.
I'm gonna do some moment.
I was just like having a seat here. And push your elbow back in towards mine. So just your elbow. I know I'm gonna grab here, but you're gonna push your elbow towards like the back wall there.
Oh, okay.
Push. Go, sorry. Good, good, good. Again, I don't like forcing these. If they go, they go, you know. Oh, we did this one, I think. Yep. We just need to do this one. Hand on your hip again. Yep, sit up as straight as you can. This is what I gotta work on. Yeah. Okay, elbow back. Good. Ooh. These are your money makers. Be careful with these. Ooh. Like I remember seeing my dentist and all the little tools, you know, that he had to use. Yeah, and I was like, whoa. Here I am with these big caveman tools, you know. He had like all these little itty bitty tools. Head back for me, like look back. A little bit. We gotta really arch you back though. Ooh, okay, and then other side. Ooh. Oh, that's nice. On your back for me. Good. Bend both of your knees. Now this is the pubic symphysis, which is on the front.
Okay.
So there's 3 joints of the pelvis. There's 2 on the back, 1 on the front. If you got low back pain, you gotta get them all. Okay. Press out against my arms as hard as you can. 5, 4, 3, 2, 1. Good. Relax. Now you're gonna go the other way and squeeze my hands.
Okay.
Squeeze for me. More. Harder. They're almost engaged. Relax, relax. It's the whole adductor muscle has to engage. So squeeze again. More. Okay. So when you go to the gym, you make sure that you're working your adductors because it's a little too much. The whole thing has to tighten for me in order to pull that part, that bone apart. Not like apart, but like to make it manipulatable, malleable. I don't know. You have to have the whole muscle. The muscle actually does it. And if you can't contract it, it won't happen.
Okay.
So just, work like on these. What we're gonna do? Oh, we wanted to do the ears. Oh, I know which one I could do. On your stomach. We'll stop if it's too much, but on your stomach for me, and you're gonna actually be like this with your forehead on your forearms. Okay, I can support you maybe like that. Take a deep breath in. Is this too much? Okay. If it goes a little bit, I'll take it. Okay. All right. Now let's do the ears. Sorry, I'm like really moving you all around.
Okay.
She's gonna hear like a little tiny crack. Lean away from me. More. Okay. That's all that is. There's nothing there. Nothing on that side. Okay. This is the side I'm curious about though, since you're so sore over here. Lean away. More. You're like, oh, no, I like this. You're in control though. It's like I can wiggle it, but I have to have a little bit. Yep. There we go. That one.
A little bit.
Like a little. That was head to toe cracking. Okay, I'm like thinking through my. What I want to show you now is how to stretch.
Okay.
Lower, lower, lower. Come this way. Right there. Stop. Right there. That's the lower part of the thoracic spine. Do you feel that?
Yeah.
Okay, bend your knees. That takes the pressure out of the low back. This is what you do for like 2 minutes, and then you can slowly roll it higher as your neck permits. Now, if you want more pressure, which it looks like maybe you don't, you would put your arms out or above you. Now that puts more weight on that side. If it's too much, just bring the arms down if they start to tingle or anything like that. If you're like this, you're gonna weigh more. There's more torque on the low back. There's more pressure on the low back. That's why I have to reduce this and then get the head back. Now you're neutral. And that's the way the body is actually meant to be. People always say tuck the pelvis. All that does is throw your organs down into your pelvis. Yep, just like that.
Felt good though. I did feel like a little crack here and then a little lower.
Yeah, because in order for me to get, okay, so the reason why your mid-back in that spot didn't move that well was because you're like this. So the zygapophyseal joints are just open. So I have to really push you to get them to close and make a sound. I'd rather just passively let you do that with that than me like trying to. I mean, I did like a little gentle one there, but I wasn't gonna like, I wasn't gonna do that to you. Okay, I'm gonna make this move.
That's good though.
Any other just seeing all these birds flying around, like.
A little dark out.
Yeah. Any other? How's that feel?
It feels good. It feels
Feel a little looser.
loose. I'm always a little cracky on this side, but.
Well, like we all kind of
Yeah.
are. Like I don't know.
But it feels
Good. Did I get them all?
Yeah.